morning, everyone. Good morning, whoever joined us now. My name is Rivka Ginsberg. I work for Leumit. Leumit is one of the 4 Kupot who give health service in Israel. Just a little bit about myself. So I'm Israeli. I was born here, been living here my whole life. I had the privilege of living in Israel my whole life. I'm married with kids, and I've been working for Leumit for 12 years. And a major part of my job is assisting new olim, integrating into, helping them in the system. Everything is new. You always need a person to turn to, just to figure out things in the beginning, not only in the beginning, but especially in the beginning of aliyah, and I'll be happy to assist you too. So we're going to start with our lecture. I'm going to share a screen here. Hold on a second. Okay, so my lecture is about the healthcare system in Israel in general and how to prepare for aliyah. So the Israeli health system is subsidized by the government. It's basically free. Well, not really free because it comes out of your taxes, but you do not pay anything for the Kupah that you join monthly. For the basic coverage, and the basic coverage is very, very good. You should know you're making aliyah. I know it's not an easy process. There's a lot of things you will have to take care of, like you said before, job, well, where you're going to live, what community you'll join, schools, whatever it is. And part of, one of the decisions you'll have to make is who your healthcare provider will be. So in Israel, healthcare is subsidized by the government. There's very good coverage. It includes medications, doctors, hospitalizations, procedures, really almost anything you would need, and want in terms of healthcare. And I'll just add on, there's mental health care included, there's dental health care. There's so many aspects that are all subsidized by the Israeli government. It's amazing. Now, the way the government decided to do it, to have really good healthcare is to have some kind of how do you say 𝗘𝘅𝗽𝗃𝗏? Oh, and I didn't introduce my colleague here, Toby. Toby, say hi, just so everyone could see you. Toby is an olim rep who speaks Russian too. So if you're more comfortable in Russian, she's the person to turn to. And we'll send her info afterwards too. So hi, Toby. So just the way the government decided to provide the healthcare is through 4 different kupot, HMOs, whatever you want to call them, healthcare providers. So the way it works is each kupah really wants you to join them, and that way they try to give better service, and it works. We try harder. So how do you choose a kupah? First of all, any Israeli citizen or resident that's recognized by the social services in Israel is welcome to join Kupot Cholim free of charge. It doesn't matter if you have pre-existing conditions, doesn't matter what you came with. Everyone is entitled for healthcare here in Israel, and it's amazing. Okay, so there's 4 different kupot, and the kupot offer the same coverage in general, but there's differences. Whoever has their micro on, please mute it if you don't mind. But there's differences when it comes to how the service is given, how close it is to your house, where you're planning to live. Do you have anyone who speaks your language? Who are the doctors that work in the clinics that are close to your house? How easy is it to access the services that the Kupah offers? Does the Kupah cover the medications that you need? And then there's the extra coverage that the Kupot offer, which could, be different between each Kupah. So you really have to do a little bit of research before you join a Kupot Cholim. Okay, so the basic coverage is decided by the government. Every few years, there's a committee that gets together and decides what medications to add on, what treatments to add on, surgeries to include, and they advance every time with the healthcare changes in the world. And in general, like I said before, you're going to be in good hands. We have good healthcare here in Israel. So now I'm going to talk about the supplementary insurance. Like I said before, every Kupah could be a little different. It could be different in the amount that the Kupah charges monthly, and the coverage of what the supplementary insurance offers you. So every Kupah has two options of extra coverage. In Leumit, it's called silver and gold. They could have different names in other Kupot, but there's basic is free. Then there's the middle level, and then there's the higher level of supplementary insurance. In Leumit, it's called gold. So basically the supplemental insurance gives you the option of choice. And many other things, but the choice, I think, is what I'm going to focus on right now, because many times people come to doctor, they have recommendation for a certain treatment, they have an assessment, and they want to get a second opinion, and go to someone who's known to be the best in Israel to decide on how to go forward with where they're standing, and that could cost quite a bit. So you have the option of going to private specialists. With Leumit Gold, you could go 3 times a year, and you pay only 200 shekels instead of, it could be over 1,000 shekels for private session with a specialist. With Leumit Silver, you could go once a year for a private consultation for second opinion. So this is like for any specialist really that you decide to go to. Each Kupah works with different lists of specialists, but at Leumit we have a huge list of top specialists in Israel that you could go to for second opinion. The Kupah itself has many specialists in all the fields that you can go to, but again, then after you go to a specialist in the Kupah, you have the option of going for second opinion through the supplemental insurance. Same goes for if there's a need for surgery. So most surgeries would be covered through the Kupah. If, let's say, a specialist in the Kupah sends your child for tubes, an ENT sends your child to have a procedure of tubes, okay? So the Kupah would cover the procedure. This is a very simple procedure in general, but I'm just giving it as an example. But you might want to choose the surgeon who would do the procedure. So Leumit Gold gives you the option of choosing basically going for private surgery instead of going to the hospital and surgeons that the Kupah would offer, which might not necessarily be any less better, but just you have the option of choosing the surgeon, and going for private surgery might be a bit faster. There's just knowing that you have the option of choice is really important. Now, besides choice, the supplementary insurance gives you many other benefits. There's just a small list of benefits here. So here we see, like, we have like all the how do you say complementary medicine, acupuncture, massage, reflexology, you name it. So for a low cost, you could go for treatments. You do not, in Leumit specifically, you do not need to get a referral from a doctor. You could just schedule an appointment with the therapist and just go for treatments. It's amazing. We believe in combining Many doctors would actually recommend, not all doctors, I can't say this to all, but many doctors do recommend, acupuncture, reflexology, besides the, regular medical care. So that's one option. And Leumit, again, offers it. You're not limited in how many treatments you can have, and the price is really, attractive. Now, this is an amazing option also that Leumit offers. You can book a personal fitness trainer to come to your house for only 23 shekels. I don't know how much, what, currency you're using in your country, but it's really super, almost free. And it's amazing. You have a fitness trainer come to your house, work with you personally, and you could, be fit. And it's covered through the supplemental insurance. Besides that, this is not on the on this מצגת, how do you say מצגת? But we do offer many discounts on exercise classes and swimming pools, and it's just, you name it, we have it. It's amazing. I really recommend taking advantage of it. You get discounts on medications. This is really important because there's, medications that are covered through the health basket have a set price, but then there's medications that are not covered through the health basket, and you could get significant discounts on medications that are not through the health basket. You're more than welcome to ask me about it after this Zoom. If you take regular medications, I could check what the coverage is, and let you know how much it would cost. So we spoke about the consultations with different physicians in Israel, discounts on dental care, and then amazing benefits for pregnancy and birth. This is something that really I don't think anywhere else offers. Hold on a second. So if you're pregnant here and you have the supplementary insurance, you have, besides all the checkups and regular visitations and ultrasounds and scans and whatever it is that you would do through the Kupah, and it's covered, you have extras. So there's so many different tests you could run, and not everyone wants to do all these tests, but if you want to do them privately, then you get very nice coverage through the supplemental insurance. During birth, you can have a doula. You could get reimbursed a nice amount for a doula during birth. You get afterbirth hotel subsidized, which is amazing. It could be, a specific afterbirth hotel or any hotel in Israel. You get reimbursed up to 400 shekels per night. Amazing benefits for pregnancy and birth. I didn't list them all. There's some, exercise trainer after birth, nutrition after birth, a lactation consultant, so many different options that you have through the supplemental insurance. Okay. Just in general about our Kupah and other Kupot, there's 4 different Kupot: כללית, מכבי, מאוחדת, and us, Leumit. Leumit is the smallest Kupah out of all 4, and I see it as a big advantage because it's more personal. You have, when you come to the clinic, the secretaries will recognize you. Your doctor will know you by name after a few times. There's more availability of appointments. You have who to turn to, me, and Toby, for instance, or the person who runs the clinic. You'll get to know the staff, and you'll feel like you're at home. We have clinics spread all over the country, over 300 clinics here, 350 clinics. Many different services that we offer all over the country. We work with all hospitals in Israel. So small kupah, but very personal and great care. So like I said, we work with all hospitals in Israel, which is important because you want the hospital that's close to you. So now, how do you prepare for aliyah? This is very important, okay? Healthcare systems from wherever you come are probably different than what you'll experience here in Israel. You want to make your aliyah process as smooth and easy as possible when you come here. The way so first of all, it's very, very important to bring your medical history with you. Okay, so you can have it on a file, but really bring a hard copy too. It's important that your medical history will specify any diagnoses you had in the past, any procedures you've done in the past, of course, regular medications. And this is for children and adults. If you had any vaccine history, vaccines might be different, scheduled different here for children. So maybe vaccines that you were planning to do were done already earlier in Israel in terms of age. So vaccines are children's vaccines are not done through the Kupah. There is a different place that usually it's not done through the Kupah. It's done through Kupot Cholim. A translation of טיפת חלב means a drop of milk. And that's where babies and toddlers are treated with vaccines, follow-ups with the nurses. After birth, they weigh in, they do hearing and vision tests and different services that טיפת חלב offers, just as a side note. But of course, you could have your baby you should have your baby checked by your pediatrician and followed up by the pediatrician. If you have any concerns about, vaccines to do and not to do, you could always consult with your pediatrician, and it's not mandatory. You have the option to decide. Okay, so just bring in your vaccine history. It's important to follow up to see that you're up to date with vaccines. And of course, when you prepare for aliyah, it's important to have someone to talk to, okay? Someone to connect and someone to follow up with once you've made aliyah. So I'm more than happy to be in touch with you before you make aliyah. I have my information here on, you could take it down or contact, Gvahim afterwards to get my information, Toby's information for if you speak Russian. What I would recommend is to, contact us, find out where you're planning to live, where the clinic close to your house will be, what services are given there. And of course, if you need any kind of medical care and continuation of care, just to make sure that you're set before you come. So like I was saying before, in Israel, they decide which medications are covered by the Kupot, which are not. So some medications you might be taking right now are probably covered, but some may not. Some may not exist in Israel. Maybe there's medications that could be, give you the right basically, if we don't have that medication, we could find other medications.
I will. May I say something, please, in that connection, which is important? Sorry. What we are suggesting all our olim that are doing the pre-aliyah is if you guys having a daily medication that you are taking, please, when you make aliyah, bring enough for 2 months. And exactly for the reason that Rivka is saying now. It's not that Israel do not have the medicine, okay? We do have all of them, but sometimes the name might be different. And by the time you go to the clinic, you go to your family doctor, it takes time, you don't want to be in stress. So just bring with you enough for 2 months. I think it's a good thing. Of course, all the record your health record if you have a disease or a problem, okay? It's always good to have it. You don't need to translate it. If it's in English, that's fine, okay? Don't spend time and money to translate it, doesn't need to, okay? Even if it's in other languages, we can help with that. Most of us understand most of the languages. And the last thing is that in the aliyah prep, we have personal consultation, and you can always choose one of them in the health system. That, of course, Rivka is here to help, but we do have a consultant in the team, and again, Leumit and all the three others are here for you, and especially Gvahim. So yeah, that was important to mention. Thank you, Rivka, and sorry.
Sure, of course. Thank you for adding that on. I was going to say, you said 2 months, if possible, 3 months of stock of your medications, even better. Some medications do require they need to be approved, so that might take a little time, not very long usually. But that's a good reason to have your medications in stock when you come. You don't want to, deal with the pressure of not having medications when you come to Israel. Like I was saying, you could find out if the medication exists here, if it has a different name, if not, what alternatives we have, and if you're getting different treatments also. What kind of treatments you need. It could be for your children, if they need child development services, how it's done, where it's done, what the coverage is. You've done previous evaluations, and let's say your child needs occupation therapy, physical therapy. Bring in all your medical history, and we'll make sure that you get the right treatments as soon as possible for making aliyah. So it's very important to be in touch with a Kupah representative, and just for you to make a calm decision on joining a healthcare provider, and be prepared beforehand. Okay, so it's important to have someone who speaks your language, of course. Hopefully you'll learn Hebrew very fast, and you'll manage, in Hebrew in Israel, but that might take time. And that's the reason we have English service in the Kupah. So I have to say, you will find this out when you make aliyah. So many Israelis speak English. They might speak it with a heavy accent. They might make some mistakes, but most Israelis speak English. That includes our doctors and our medical staff and our secretaries, and so don't worry, you could speak in English. Someone's going to be there to help you in your language. So there's the National Call Center, and Leumit, the number is *507. Each Kupah has a different number, of course. That's where you can schedule appointments. You can ask for different information. We have English speaking representatives in our call center, and of course you have me. If you have questions, you could WhatsApp me, you could call me. So I'm here to help. Now, Leumit has online services. So easy, so user-friendly. I highly recommend to use it and enjoy the online services. There's on the phone app of Leumit, and then there's the website. When you come to Israel, if you join Leumit, you will ask the secretaries for a first-time password, and then you can get into your app and make your own appointments. You can order medications to your house. This is amazing. For 9 shekels, you don't even have to get out of the house. You can write to your doctor, renew prescriptions, get reimbursed for different things. All this can be done through the app and the website. Amazing services. I have to say, there's a little thing here. The app and the website services are in Hebrew. This is the same for all 4 Kupot. But if you play around with the app, you'll figure it out. It's very, very user-friendly. If you're having any trouble, you can contact me and I'll try to help you figure it out. Once you mastered this, your life is going to be so much easier to make appointments, to be in touch, to get things done. It's very, very easy. Another online amazing service we have is pediatrician consultation online. You could contact through the app. There's this device that you can get. It's called 𝗘𝘅𝗽𝗍. It's not expensive. This device gives immediate information to the doctor. If you put it in the ear, it will show him the ear. It could check the heart rate. It could check the throat. It could check if there's a rash. It just gives, it's so high tech, and the doctor could, if it's in the middle of the night, your baby has fever and you don't know what to do, you could contact a pediatrician online with this type of device, and they'll basically do an online visitation with your baby and recommend what to do. There's also a nurse's hotline and a family doctor consultation online. So usually you would call the nurse's hotline in case of, emergency. Things come up after hours. You don't know where to turn to, what to do. You could call up our nurse's hotline. They'll refer you, if necessary, to hospital or to after hours clinic, or let you know that it's not such an emergency and you could just wait for the morning and you'll be okay. It is important to know that, just as a side note, and this is the same for all kupot, if you go to an emergency room without a referral and you do not get hospitalized, if it's for stitches or a bad asthma attack or allergic attack, so this is not for everything, but in general, if you go to an emergency room and you do not get admitted overnight, so you might have to pay for your visit in the emergency room. But if you do get a referral from the Kupah, from a nurse or from a doctor, then you will not pay the visit to the emergency room. So if you have the time and it's it's an emergency but not a huge emergency, call the hotline and get a referral before you go to an emergency room, or before you get ambulance. Again, if it's a real emergency, you just call an ambulance. Whatever, you might not need to pay anything, or you will, but just make sure you call for help if it's a real emergency. But if you do have the time, you're not sure if there's a fracture in your child's arm, so you do have the time to call the nurse's hotline and decide whether to go to the hospital or after hours clinics that work with the Kupah, and you will not pay the copay if you call the hotline and get a referral. Okay, so we have different services online, Facebook, Instagram, you name it. You could follow us and get updates and tips, whatever it is we put online. And here you have my information. You're more than welcome to contact me with any question. Like I said before, this is so important before making aliyah. I'm sure you have your concerns, your questions. There's so many things that people want to know before making aliyah. I'm here to talk to you. I'm here to be in touch, especially via WhatsApp or email me and Toby in Russian anytime. Please be in touch with me. And also, once you make aliyah, I'm here afterwards to assist you. If you're going to be around my area in Beit Shemesh or Yerushalayim, I could also meet with you in person and set you up in the system and guide you once you're here. I'll be happy to answer any questions if you have right now.
So there are two things that I wonder about. One is I think that the thyroid medication I'm currently on is not available in Israel. It's pork derived, and I think it's only licensed for the US. I'm on NP thyroid. There's one that's similar called 𝗪𝗪𝗏. There also used to be a third one, but the synthetic ones that aren't
Okay, so I did not hear the whole thing. Your connection was not so good, but I kind of understand your question. Hopefully, I'll give you a good answer. Like I said before, this is why it's important to contact us before making aliyah. You'll send me your the exact dosage and medication that you take. I'm in touch with our pharmacists to find solutions in case the medication does not exist here in Israel, or maybe it does exist, but in a different name. And that way I could give you the information before you make aliyah. You could consult with your doctor for wherever you're living right now to see if they think that would be a good solution, and we could work something out. I'm sure you can. You're probably not the first person, using that medication who will need, in whatever condition you are in Israel, and you'll get good treatment here. So I'll just make sure to give you the right information about which medications we have that would give you a good solution, the cost, the coverage, and I'm here to help you.
I just want to find out, out of the four options you have, what is the best way to know which one to choose as we're going to Haifa?
Okay, so I think the best way to find out is if you do know people around the area that you'll be moving to, speak to them, get an idea of what they recommend, and speak to representatives of different kupot to get answers for your questions. You could do some research. I believe in speaking to people, and neighbors and friends, and representatives of the different kupot, and getting the feeling of what will be the best decision for you. And the questions, again, the questions that you would ask is, what kind of services the kupot offer close to your house? How available are the doctors? Do they speak your language? What the cost is per month? The treatments, the medications that you need. Does this specific kupah give you good answers? Like what you just ask all these questions beforehand. Speak to people.
Okay, perfect. And then let's say now you choose a certain medical system, one of the four. Is there limited when you want to move over to another one? How many times you can do it?
Great question, and sorry I did not mention this before. It's very easy to switch between kupot. It does not cost any money. You could do it online. Every 2 months, there's a date to a deadline where you could switch. And then there's a small waiting period until it takes place for you to, finish whatever appointments you had, to take care of, get all your medical files just in order to settle in the new kupah easily. But yes, if you joined one kupah, you feel it wasn't the right decision for you and you want to switch, you're always welcome to switch. But I'll just put this as a side note. You could switch up to twice a year, meaning they don't want you to, flipping around different kupot every 2 months. So you have a limit of doing it twice a year, but every 2 months there's a deadline of switching kupot.
In our preparation core, in that chapter, I have a table. I created a table with the dates, okay, when you can switch. And as Rivka said, we don't recommend to, play with it too much and every 3 months change kupah, because again, it's important to say the health department in Israel, okay, the medical treatment in Israel is very high, very good. All the four kupot are giving more than the base, which are almost parallel to all the four kupot. Of course, there are small added values for each one, obviously, but the basic, it's the same. And most important is to know in the city that you live and in the area that you live, which Kupah is near your future house, maybe a doctor who speaks the language. There are some, things you can do before that. For example, ask your friends, family members, which Kupah do you go? Are you happy? Stuff like that. But yes, to answer your question, you can switch.
Anyone else? Questions?
Yeah, I have a question.
Hi.
Hi, I've been told that there's an initiation fee to be insured from like day one and like 12 to 14,000 shekels.
Okay, so this is not exactly accurate. I'll tell you how it works. If you're a Nuola, there's no initiation fee of the 12,000 shekels. If you're in a status of a returning citizen, that's probably what you're referring to.
Yeah.
Meaning a person who's an Israeli citizen already left the country and is returning, then there's a waiting period of a half a year till you're entitled for Kupah services. If it's important for you to have Kupah coverage from day one, then there's this fee of 12, 13, I'm not sure exactly how much it is right now that you would pay for Bituach Leumi. But if you don't have, serious medical needs, you could just take out a private insurance to have coverage. It will be more basic, I believe, than what Kupot would offer you, but it might give you enough of an answer for these 6 months, because it's a big chunk of money to pay from the beginning. But again, some people come, I hope this is not your situation, but some people come, if they need, if they find out they have, cancer and they need treatments, and treatments are super expensive, and it's worth it for them to pay the 13,000 shekels right away to make sure they get, the full coverage from the beginning. So then, yes, but this is not for new olim. This is just for returning citizens and returning citizens over 18, meaning if you left before you were 18, you're in a different category. You're a minor returning, and minors returning do not have to pay this fee. If a person was an Israeli citizen before they left the country before they were 18, then they do not pay this fee either when they're returning.
So if you return and you're a returning citizen, you would need to pay that 13,000 or wait 6 months. After the 6 months, is there a fee that you pay?
No, not for the basic coverage. Only if you join the supplemental insurance, there's the monthly fee, which is not high. It depends on the age, but no, you get full coverage like any other Israeli citizen.
Perfect, thank you.
Also, regarding that question, because I'm a returning citizen myself, when you do return, please go and check. Sometimes they do a promotion. For example, 6 years ago, when I returned with my husband, and we did want to check if to pay the penalty or to continue with the personal insurance till the 6 months are over. And we were lucky there was a promotion, and instead of paying 11,000 each one, it was 11 for the couple. Obviously, when doing the comparison, it was much better to go immediately into the Kupot Cholim and not paying a personal insurance. So those who are returning citizens, check it with Misrad Aliyah Veklita. Sometimes they do some promotion, maybe now because of the war, it's a win-win. But anyway, do not stay 1 day without a cover, okay? Please, either if you pay the penalty or you continue with Signa or whatever instruments you do have, do not stay without a cover, please.
Okay, that's new to me about the promotions. Thank you for that. Just make sure to declare you're a returning citizen as soon as possible when you come, and also make sure not to leave the country for half a year, because they'll start the count again from when you return. So if you want to go visit your country, do not for a half a year.
Sorry, if you're unemployed, isn't it? It's your workplace that pay for the Kupah. So what if you are unemployed when you arrive to Israel? You don't have a job yet. So how does it work?
So the payment does not go straight to Leumit or whichever Kupah you choose. It goes to Bituach Leumi through your salary. Your employer would pay the taxes through your salary. Now, if you're not working, I know new olim do not pay. Now, Mayan, correct me because I'm not a huge, I don't have huge knowledge about this, but as far as I understand, you don't pay these taxes for half a year. So that gives you that window of time that you do not pay taxes.
Yes, the salklita, yeah, as an ole, the salklita is for 6 months, exactly.
But if
Okay,
you return, like I have Israeli
Right.
citizenship, so
so I don't.
No, the salklita, the returning citizen do not receive a salklita. Okay, the benefits are much different and less, much less, almost nothing. Regarding the Kupot Cholim, again, you need to check your status with them. It's Bituach Leumi and Misad Aliyah V'Klita. They can tell you which is your status, if you need to pay and how much. And you do you check what is better, to wait 6 months and pay a personal health insurance outside that will cover you in Israel, or to pay the 13, 11, I don't know how much is these days, but yeah, up
Just,
to you to decide.
Just to clarify, during the time that you're not working in this gap and you do have to pay, you pay Bituach Leumi. It's a certain amount per month. Let's say you're waiting these six months and you're not employed. Whatever the amount is, you pay Bituach Leumi during these 6 months, even if you do not have coverage for Kupot Cholim during this time. You turn to Bituach Leumi and pay whatever the fee is per month. This is not towards Kupot Cholim. This is just regular taxes that you pay for social benefits in Israel.
Any other
For the
questions?
supplemental insurance, where do you find the rates?
There's
Online?
information online. Each Kupah has a price list according to age and level of coverage. You're more than welcome to turn to me with your information, the age, the number of family members making aliyah, and I could compare prices for you. Leumit happens to be usually a little less expensive than other Kupot, but again, a few shekels to here and there.
Thank you.
Thank you for hosting me, and thank you anyone who
Pleasure.
joined. Behatzlacha, we say in English. Good luck.
Thank you.